Ever feel unprepared for the unexpected? Today we're building a DIY first aid station packed with essentials for any emergency. From minor scrapes to bigger mishaps, we'll show you how to be ready for anything. I'm Zico, and we're diving into the science and practicality of being prepared. Not just tossing stuff in a box, but engineering a real solution. Think of this kit as your personal safety checklist. Simple, smart, and something your future self will thank you for. By the end, you'll have a complete, customized first aid station, and you'll know exactly why each item matters. Let's get started on building the ultimate 10-minute emergency kit. First up, the undisputed champion of first aid, adhesive bandages. These little wonders are often the first thing you reach for when dealing with minor cuts, scrapes, or blisters. They're a staple in every first aid kit for a reason. Don't just grab one-size-fits-all strips, variety is absolutely key. A boo-boo on your elbow needs a different solution than a paper cut on your finger. Having a range of sizes and shapes ensures you're prepared for anything. Small circular bandages are perfect for nicks, those tiny little cuts that seem to bleed more than they should. They're also great for covering up blemishes or small wounds on the face. Standard rectangular ones are your go-to for everyday cuts. These are the workhorses of your bandage collection, suitable for a wide range of minor injuries, and large ones are essential for big scrapes. Cover all your bases. Don't underestimate the importance of having these on hand, especially if you have active kids or enjoy outdoor activities. Knuckle and fingertip bandages are specifically engineered to stay put on tricky spots. These specialized shapes conform to the unique contours of your joints, providing a secure and comfortable fit. They're designed for maximum flexibility, moving with you and protecting wounds as they heal, even with constant bending and flexing. No more bandages popping off every 5 minutes. Properly sized bandages help wounds heal up to 40% faster by creating a moist, clean environment. This optimal environment promotes cell growth and prevents scabbing, leading to quicker and more effective healing. It's not just about covering a cut, it's about optimizing healing and preventing infection. A bandage acts as a barrier against dirt, bacteria, and other contaminants that can hinder the healing process. Stock your kit with a variety pack, offering a convenient assortment of sizes and shapes in one package. This is a great way to get started and ensure you have a good foundation of bandage options. Or mix and match boxes for a deep bench of options, tailoring your bandage selection to your specific needs and activities. Consider factors like your lifestyle, hobbies, and the ages of people in your household. I keep at least 20-30 bandages of different sizes in my kit. It might seem like overkill, but trust me, you'll be glad you have them when you need them. You'll be surprised how quickly you go through them, especially with kids around. Little accidents happen all the time, and having a readily available supply of bandages will save you time and stress. This is the foundation of your kit. Make it strong. A well-organized and comprehensive bandage selection is the cornerstone of any effective first aid setup. Don't skimp here. A well-stocked bandage supply is your first line of defense against minor injuries and a crucial component of responsible preparedness. Ready? With our bandage arsenal fully loaded, let's move on to the next essential item in our first aid kit. Bandages. Simple, but genius in their ability to protect and promote healing. For bigger wounds, where the bleeding is more profuse and the risk of infection is higher, you'll need to step up your first aid game. These types of injuries require more than just a simple bandage. They demand sterile materials and a methodical approach to ensure proper healing and prevent complications. That's why you need sterile gauze pads. These pads are specifically designed to be free of any microorganisms, reducing the chance of introducing bacteria into the wound, and of course medical tape to keep everything securely in place. The right kind of tape is crucial for effective wound care. Gauze acts as a super-absorbent sterile cushion, drawing away blood and other fluids from the wound site. This helps to keep the area clean and promotes faster healing. It also provides a protective barrier against external contaminants. Remember, never use random cloth or paper towels. These materials are not sterile and can introduce harmful bacteria into the wound, leading to infection and delaying the healing process. Always stick to sterile medical supplies for wound care. Medical tape holds gauze in place, is hypoallergenic, minimizing the risk of skin irritation or allergic reactions, and it removes easily without hurting skin, ensuring a comfortable experience during dressing changes. The gentleness of medical tape is especially important for sensitive skin or when dealing with wounds in delicate areas. The key: apply direct pressure with gauze to control bleeding. This is the most effective way to stop or slow down blood flow from a wound, and if it soaks through, add another pad. don't remove the first. Removing the soaked pad can disrupt the clotting process and restart the bleeding. Layering pads maintains pressure and absorption. Secure everything with tape to keep the gauze firmly in place and prevent it from shifting or falling off. Or even better, self-adherent wrap, Coban, which offers a more secure and flexible hold. Because it sticks to itself, not skin, it avoids pulling or causing discomfort upon removal. This makes it an excellent choice for wrapping injuries on joints or other areas that require flexibility. Stock several sizes of sterile gauze pads to accommodate different wound sizes and shapes. Having a variety of sizes ensures that you can effectively cover any injury, big or small, and at least one roll of tape to secure the gauze in place. Don't underestimate the importance of having enough tape on hand. Add a roll of self-adherent wrap for easy, secure bandaging. This versatile wrap is a must-have for any well-stocked first aid kit. These items let you handle more serious injuries with confidence, knowing you have the right tools and materials to provide effective first aid. They're the heavy hitters of your kit, the essential components that can make a significant difference in managing more severe wounds. With these, you're ready for more than just minor scrapes. You're prepared to handle situations that require a higher level of care and attention. Let's keep building. Next up, keeping wounds clean, which is a critical step in preventing infection and promoting optimal healing. Before you even think about reaching for a bandage, there's a crucial step you absolutely cannot overlook. You need to thoroughly clean the wound. This is non-negotiable. That's where our trusty allies come in: antiseptic wipes and antibiotic ointment. These are your first line of defense against infection. Antiseptic wipes are designed to kill germs instantly, providing a rapid and effective way to disinfect the affected area. They're incredibly convenient, especially when you're far from readily available resources like soap and water. Think hiking trails, camping trips, or even just a busy day out and about. When using antiseptic wipes, remember this golden rule: always wipe away from the wound. This technique is crucial to avoid pushing dirt and debris further into the wound, which could lead to a deeper infection. After thoroughly cleaning the area, gently apply a thin layer of triple antibiotic ointment. A little goes a long way. This ointment plays a vital role in preventing infection and significantly speeding up the healing process. The ointment works by creating a protective barrier that keeps wounds moist, which is essential for optimal healing. Maintaining moisture reduces the likelihood of unsightly scarring and also prevents bandages from sticking to the wound, making removal much easier and less painful. When stocking your first aid kit, aim for at least 10 to 15 individual antiseptic wipes. You'll be surprised how quickly you go through them. And don't forget a good-sized tube of triple antibiotic ointment. Check the expiration date periodically to ensure it's still effective. These seemingly tiny items are in reality your best and most reliable defense against potentially dangerous infections. They're incredibly cheap, remarkably portable, and absolutely crucial for any first aid kit, whether at home or on the go. Under no circumstances should you skip this vital step in wound care. Properly cleaned wounds heal significantly faster and, more importantly, much safer. Now that we've covered the essentials of wound cleaning, let's shift our focus and talk about some of the other important tools you'll want in your first aid arsenal. Next up on our list are tweezers and medical scissors, two indispensable tools for any well-equipped first aid kit. Every kit needs tools, specifically tweezers and trauma scissors. Tweezers are essential for removing splinters or debris. Choose fine-point ones for precision. Always sterilize tweezers before use to avoid introducing germs. Trauma scissors, with their blunt tip, safely cut clothing, tape, or gauze without risk of injury. They're perfect for trimming bandages and tape to size. Don't rely on your teeth or fingers. These tools make first aid cleaner and faster. Keep both in your kit and you'll be ready for anything from splinters to serious cuts. Simple tools, big impact. Next, let's protect both you and the person you're helping. Gloves are up. Medical gloves are a must. Always put them on before treating any injury. Nitrile gloves are best. They protect against germs and avoid latex allergies. Gloves shield both you and the injured person from infection and bloodborne pathogens. Pack at least 2 or 3 pairs. Gloves can tear, or you may need to help more than one person. They take up almost no space but are invaluable for safety. Never skip gloves. They're your first line of defense. PPE isn't just for hospitals, it's for every first aid kit. With gloves on, you're ready to help safely. Now let's tackle pain and fevers. Pain relievers are next. Stay protected, stay prepared. Let's move on. Sometimes the problem is pain, headaches, sprains, fevers. Include both ibuprofen for inflammation and acetaminophen for general pain and fever in your kit. Use single-dose, individually wrapped packets for safety and convenience. Always check dosages and allergies before giving any medication. Consider adding low-dose aspirin for heart emergencies, only if you know it's safe. A few packets of each can make a huge difference in comfort and recovery. Medications turn a miserable situation into a manageable one. Next, let's add a diagnostic tool, the digital thermometer. Relief is just a packet away. A digital thermometer is essential for tracking fevers and assessing illness severity. It gives you hard data, no more guessing by touch. Modern thermometers are fast, accurate, and easy to use. Choose one with a protective case and check the battery every 6 months. Pack a few disposable probe covers for hygiene. This small device turns your kit into a basic diagnostic station. It helps you decide when to treat at home or seek medical help. Don't leave it out. Knowledge is power. Now let's talk about staying warm in emergencies. The emergency blanket, aka space blanket, is a lifesaver. It reflects up to 90% of body heat, preventing hypothermia and helping treat shock. Lightweight, compact, and multi-purpose. Use it for warmth, shelter, signaling, or even collecting rainwater. It's waterproof, windproof, and highly visible. Keep at least 1 or 2 in your kit. They take up almost no space. Unfolded, they're surprisingly large and effective. This simple technology can make a massive difference in survival. Don't underestimate it. Next, let's cool things down with cold packs. Your kit is almost complete. For sprains, bruises, or bites, instant cold packs are a must. Squeeze to activate. An endothermic reaction makes them ice cold in seconds. Cold reduces swelling and numbs pain, speeding up recovery. Always wrap the pack in cloth to protect skin, and use for 20 minutes at a time. They're single use, so pack 1 or 2 and replace as needed. No freezer required. Perfect for on-the-go emergencies. Chemistry at your service. Cold packs are your best friend for active lifestyles. Now let's personalize your kit. The final step: customization. Customization transforms your kit from generic to personal. Add any essential medications, EpiPens, inhalers, glucose tablets, or child-specific items. Check expiration dates regularly and restock as needed. Anticipate your family's specific needs: motion sickness, heartburn, or baby care. Include a waterproof card with your name, medical conditions, allergies, medications, and emergency contacts. This info is priceless in an emergency, helping responders act fast and notify loved ones. A simple card can be the most critical item in your kit. Personalize for your needs and you're truly prepared. Your kit is now complete. Let's wrap up. You're ready for anything. That's it. A complete, customized DIY first aid station built in about 10 minutes. You're now ready for anything from paper cuts to real emergencies. Keep your kit accessible and check it every 6 months. If you found this helpful, like, subscribe, and share. Let me know in the comments what you keep in your kit. Stay safe, stay curious, and be prepared.